Good morning. I am trying to work so my camera can come on. Good morning, good afternoon, and potentially to some of our international colleagues, if there's anyone on this session, good evening. So, welcome everyone to the Society for Health Communications Level Up Learning webinar series titled Countering Chaos and Manufactured Controversy in Health. My name is Ashani Johnson-Turbis. I am the president of the Society for Health Communication, and the Society is pleased to hold this webinar today, which I'm really pleased to report marks, I think, pretty much the highest number of registrants that we've ever had for a webinar. So we are truly elated about this and to have so many of you, so many of our colleagues here for this session today. Before we get started, I just want to say a little bit about the Society for Health Communication. You can see here on the slide, we were founded in 2016 to unify the field across industries, ultimately to have one unified, one singular vision. Our mission also written on the slide. I won't read it to you because I know you all can see it. You see our mission stated there, and we are really proud that we can boast over 5,000 members, over 5,500 members to be really precise. And we are growing fast. And hopefully, any of you that are joining us for this webinar, Level Up series webinar, if you're not members of the Society for Health Communication, please go ahead to our website and become members of the Society. It is free. Our executive team can be seen on this slide as well. It includes me as president, Stacy Robeson with Communicate Health. We have Stephanie Miles with Force Marsh, Michael Grilla, our past president with Inzio Evoke Comms, Dana Chimenko with Vanguard Communications, and our own Diane Brodowski with the Society for Health Communication. Next slide, please. Before we jump in, and I have the honor of introducing our speaker today and also saying a little bit more about Stacy. She'll be handling the Q&A. Let me just do some webinar housekeeping. All attendees, you are automatically muted. The session is being recorded, as I'm sure you heard at the very beginning when it said this session is being recorded. It will be available on the Society website with the slides in the coming weeks. The chat function is open for discussion and connection. A lot of good things I've noticed always happen in the chat. That's where exciting conversations take place. Please submit all of your speaker questions through the Q&A function under the webinar options at the bottom of the window. Send a chat message to the host if you have any technical difficulties and press the CC button in the bottom left corner to turn on closed captioning. However, if you're like me, that it may be in the bottom right corner. So just check left and right if you need that. So now I can go ahead and introduce our speakers. So I am very proud to introduce first Julie Sweetland. Dr. Sweetland is a sociolinguist and a senior advisor at Frameworks Institute, the Frameworks Institute. Since joining Frameworks in 2012, Julie has designed and led reframing initiatives on climate change, education, education equity, childhood adversity, and more. Her skill in translating framing research into communication strategy has helped advocates, policymakers, and scientists drive change at the national, state, and grassroots levels. Since 2017, Julie has worked primarily with the public health sector, bringing the science and strategy of framing to health topics like health equity, tobacco control, maternal mortality, science and strategy and childhood vaccination. Julie's linguistic research has focused on the intersection of language and race, with a particular focus on how language can be used to disrupt racism in schools and beyond. And I also get to share a fun fact about Julie, and that is that she has visited 47 of the 50 United States. So if you need a speaker in North Dakota, Montana, or Idaho, she would like to meet you, and she can fill out that list of 50 states. Stacy Robeson. Stacy is vice president of the Society and the president and co-founder of Communicate Health, a self-proclaimed health literacy geek and an expert in clear communication. I can attest to that. Stacy is responsible for leading Communicate Health's content and creative excellence. Since co-founding the company at the tender age of 30, Stacy has been recognized as an innovative business leader by the U.S. Women's Chamber of Commerce. She has appeared in the Washington Post, Boston Globe, and Healthcare News, among other media outlets, discussing a variety of issues from entrepreneurship to health behavior change. Stacy is a founding member of the society and previously served in roles on the steering committee and on the advisory board. Fun fact about Stacy is that she is a certified skipper and she recently learned how to sail 40-foot boats. So, with that, I have the honor of being able to give the stage to Dr. Julie Sweetland.
Thank you so much, Ashani. It's good to be here with you all. And now I want to talk about skippers, but instead I will talk about countering chaos and manufactured controversy in health. I'm delighted today to be appearing on behalf of my colleagues at the Frameworks Institute. We're a nonprofit celebrating our 25th anniversary this year. We're a group of social scientists and social change strategists that design, conduct, share communications research so that folks like you working in the mission-driven sector can lead more productive public conversations on the issues that matter to us all. And right now, the issues that matter to us all, woo, feels like there's a lot of them. In a moment like this, when there is so much going on and so much deceptive discourse being spread, it can feel impossible to counter it. And in some ways, that feeling of, wow, this is hard, it is true right now that the scientific consensus on many health topics is in an asymmetrical contest with unsound, unsupported, unscientific, and sometimes unscrupulous ideas being spread by powerful voices. I'd say one thing that we can control in a moment like this is the way we communicate. And the way we communicate now in this noisy, uncertain, and chaotic moment will affect what's possible later. Now, I won't pretend that just gaining clarity about the messy, muddled information environment right now will automatically or easily bring us to a better place. But I do know that we can't counter public dishonesty without getting clear about what's happening. And looking to history and social science for insights on what has worked in the past or has been shown to work in rigorous studies can be helpful. Specifically, gaining clarity about all the chaos will help us to prepare ourselves to respond, not merely react. So, the first idea I want to offer here is that I think right now we are up against three particular types of deceptive and dangerous discourse in health. These aren't the only three types of dangerous discourse. Hate speech and conspiracy theories are other examples, but I'm focusing on these today in part for reasons of time, but also because, again, I think that these are the specific things that are happening, particularly in health right now. The first is misinformation or disinformation, and this is when falsehoods are repeated. If that's done without intent to mislead, that can be misinformation. If it's done with intent to mislead, the person knows it's not true and is spreading it anyway. That's what experts call disinformation. A manufactured controversy is also a type of misinformation, but it's a little different. It's a contrived debate to specifically designed to create confusion despite an established consensus. And then the third type of deceptive and dangerous discourse that we're experiencing right now is a moral panic. This is when people are trying to stoke up a disproportionate social reaction to something that is a perceived threat, that they're painting as a threat. There may be some level of actual discomfort or danger involved, but the idea is that this is an exaggerated response to something. So, for an example, right now in health, let's take the idea of fluoride. The misinformation or disinformation is that fluoride lowers IQ, right? Somebody who's just repeating that because they heard that, an ordinary person, right? That's misinformation. When someone understands that the research base for that data, for that claim, is not right? That data is not coming from the levels, the very low levels of fluoride being introduced into drinking water, right? That idea that fluoride is a neurotoxin is coming from a very different type of research and a very different context. That's disinformation. A manufactured controversy might be something like, we really should study the safety of fluoridated water. And, it's manufactured because, dude, it's been studied. Same with what we're hearing right now about investigating the link between the MMR vaccines and autism. It's been studied. And then finally, a moral panic. This is not widespread right now, but on fluoride, right? Oh my gosh, it's a mass medication of the public. Beware what they are doing to you and your kids, right? So one thing we can do is be more develop the practice of rapidly diagnosing, right? Which type of deceptive and dangerous discourse we're interacting with, because the tactics and moves that we can make to interrupt those and counter those are sometimes slightly different. They have things in common, but there are some specifics as well. So, first, I'll go through a little bit on manufactured controversies and then move to moral panic. Again, a manufactured controversy is a deliberate attempt to create the appearance of a debate. This is, for instance, this is drawing heavily on the work of on merchants of doubt, which I'll cite in a moment. One thing is to remember in any of these three types of discourse that there are some basic emerging best practices in countering any type of untruth that's being spread through public discourse. Yeah, I'm sure you've heard, don't repeat the disinformation, but what do you do instead? Explain what is true and crucially give people a way to understand how the issue works in reality in a way that's very simple and easy to grasp and repeat. Be sure that you're warning against the fallacy, right? Characterizing the ideas as false or harmful, working hard not to characterize them in starkly partisan or hyper emotional terms. It's devastating or those sorts of things. It is helpful to unmask specific disinformation tactics. I worry aloud that by cherry picking this data, or by taking this, I'm concerned that by taking this finding out of its context, we're misleading people away from an intervention that can be quite helpful, things like that. And always be sure that you're expressing your care and concern. The old saw that they don't care how much you know until they know how much you care is really vital in these moments. Your expertise can be part of the solution, but if you are only signaling I'm the expert, that is not going to be helpful. So doing a little bit to talk about why this matters to you personally in a measured tone, not, no one's not suggesting you wear your heart on your sleeve or go into deep personal stories. But do take offer some explicit statements about why you care. And that's because we know that paternalistic appeals to scientific authority and the research that we do at Frameworks, we have seen that backfire again and again and again. So phrases like the science says or the science is settled, um, or 97% of scientists agree. Those kinds of messages are not as helpful as we often think they are. There's a different way to put science in the story, and I'll say a little bit about that in a moment. Naked numbers, just throwing out facts, particularly statistics, when there are when there are competing and false ideas going around. Those numbers on their own are not helpful, no matter how big a font of you put it that you put it in. A number does not have magical prove your point powers. It's important that we nest any numbers, any data in a narrative. And finally, playing in quote unquote their frame. And by they here, I mean people who are intentionally spreading falsehoods. Often, right, they are setting up predictable scenarios that people are going to respond through. And so accepting that scenario, for instance, that there are two sides to the story, might be one of those. Um, Accepting that framing is often painting yourself into a communications corner. All right, so those things won't work. What can work when we're dealing with a manufactured controversy? For instance, that are vapes safer than cigarettes? Is climate change real? Or today, is there has the safety, right, of the immunization recommended schedule for childhood immunizations been studied enough? Those sorts of things. I think here this is looking to the work of Naomi Oreskes and Conway can be quite helpful. Their book Merchants of Doubt, and then the many studies that have been done within that framework since then. First of all, understanding who are the merchants of doubt. And the phrase merchants comes because often there is a profit motive here. Who are those people funding and fueling the debate? Knowing the source helps you understand the motivations. And that's really important because in some instances, naming a villain can be helpful, not in every instance. And I'm happy to say more about that if people have questions. But I think more importantly than whether or not you want to name, right, the source is helping you understand what is the goal of the contrived controversy. For instance, as the fossil fuel industry, right, was seeking to stoke debate on whether or not climate change was happening, the idea was to create long delays, right, before there were restrictions on the use of fossil fuels and more investments in forms of energy that do not add to climate disruption. And so delaying action, right, was important in order to maintain, right, the profit base from that source. Sometimes there's a contrived controversy to damage reputations. The recent supposed confusion over the racial and ethnic identity of a major political candidate in the last election comes to mind? Or is it to influence public opinion writ large in order to reach other goals? So thinking about that. Finally, so once you understand the goals, it helps you think through how to intervene more strategically. Thirdly, what are the cultural mindsets that the merchants of doubt are banking on? It's very difficult to create a controversy that does not tap into some sort of pre-existing assumption in American society. So there is going to be some sort of widespread belief or social norm that allows the debate to gain some sort of traction. For instance, the idea that we should be investigating both sides of every issue, and it never hurts to ask a question, right? Those are social norms that come from our um, long-standing and taken for granted, right? Freedoms of expression, freedom of scientific inquiry. And so folks tapping into those mental models is some of what gives the controversy power. So understanding what those mindsets are gives you a strategic advantage in responding. Let me give you a couple of examples of what I mean by that. So right now, when we see efforts to cast doubt on the safety of fluoridated water, the typical talking point that I've seen, which is true, right, it comes from rigorous analysis, is that fluoridation reduces cavities up to 25%, right? So that's what the public health or health voices are saying. But what I can see from the point of view of public mindsets Well, okay, cavities. What I know from our research on how people think through oral health issues is that people think cavities are a minor personal health issue. Maybe it's a cosmetic or a temporary pain problem, but it's not actually that serious. Now, that's how people mentally model that. My framing insight there is that talking about cavities isn't going to elevate any type of concern, right, about the lack of fluoridation in water. Instead, I'd go more towards explanations of how oral health affects overall health, because that's new news for people. And so, my messaging advice there is to talk a little bit more about if we allow oral disease, cavities are one example of that. If we allow untreated oral disease to continue, it can spread to major organs. And very few people, too few people have regular routine access to good dental care. And so fluoridation is one important preventative measure we can take to keep our mouths healthy, which is part of keeping our bodies healthy. Again, I don't want to suggest that just making that one move is going to be magic, but it is certainly going to be more effective than repeating a 25% reduction in a thing people don't really care about that much and don't see as a public concern. Second, another example, how understanding the public mindsets can help you find better counter messages. Vaccines are safe and effective. Again, that is true, but it's a social or it's a health analysis. It's not a great communications analysis at this point. Because our research into how people, again, mentally model how decision making around vaccines is most Americans think risks are a real factor. And even if they themselves are fully vaccinated, want their kids to get vaccinated, they believe that the existence of those risks should allow other people, right, the freedom to decide. And again, I'm all for bodily autonomy. I don't think we should be forcing anyone to be vaccinated, but we should have, I think, a role for policies that support and increase and protect widespread levels of vaccination are critical. So people think risks are real. Our framing insight is that persuasive techniques that are just on the risk side of thinking have little effect. We found that boosting the reward side of thinking can help, particularly when it comes to childhood immunizations. And we found that talking about how widespread childhood vaccination keeps schools to be healthy, safe places and keeps kids focused on learning, playing, growing, doing the things kids can do, that type of messaging was much more effective than scare tactics about just how bad the measles are. Before I go to the next slide, I'm going to ask you to just read this for a moment. I'm going to pop into the chat just to make sure nobody on the panelists team is flagging anything that I'm messing up or anything. That looks good. All right, so we are going to here look to some examples of what this would look like side by side. So on the left, I think this is an appeal to scientific authority. Despite growing vaccine skepticism based on misinformation and debunked studies, scientists who conduct research on vaccines overwhelmingly agree that immunizations make children safer, not less so. So this is saying lots of people are being fooled, but the scientists know the truth, and what you believe, vaccine skeptics, is just wrong. And while that may be scientifically accurate, it's not effective communications. So, a more invitational rhetoric, inviting people into your expertise, and giving people, again, that sense that how does it work is really critical. It shows people the respect of you're asking them to think for themselves. And then also on this other example, there's a cue towards your care and concern. So we can all agree that schools should be safe places where kids can focus on growing, playing, and learning. And widespread immunizations keep kids healthy and boost our community immunity, particularly in schools, right, where it's easy for contagion to spread. So subtle differences there, I think, but our research suggests that they are powerful, subtle differences. Here's another example, engaging in the contrived debate. So across the nation, healthcare providers are getting more and more questions from families about whether vaccinations are safe for their children. So this is giving more air to the controversy itself. And then saying the experts have settled this, right? Doctors, nurses, and researchers agree. The answer is yes, in general, vaccinations are safe and effective. But then, right, reminding people that there are risks, thereby suppressing people's support for strong pro-immunization policies. Instead, we can advance a different narrative. Our research has shown that a conversation about vaccination access is much more likely to boost support for strong immunization policy than continuing to bemoan their low rates of uptake. So that might look like this. Our healthcare providers are hearing more and more stories about practical difficulties in keeping up or catching up on routine immunizations. Our issues range from lack of insurance coverage to the ability to the fact that it's hard to attend multiple appointments. Maybe it's that their folks are moving, their medical records aren't coming with them. Whatever it may be, that's the access issue. We find that that's a more effective, more persuasive point in changing the surround sound on this issue. And then reminding people that we have a responsibility to make vaccinations for children widely available, easily accessible, and deeply affordable. So those are some examples, and that comes from our research done in partnership with the American Academy of Pediatrics. But of course, we're seeing lots of other manufactured controversies right now. For instance, um, the idea that DEI is somehow, right, responsible for everything from, tragic jet accidents, to who knows what else. So the words can become politicized very easily. We've seen a lot of energy, attention put behind mischaracterizing some specific words. I have advice. Frameworks has resources on some of the specific words that are being manufacturing controversy over them right now. But there will be lots of them, right? It can be hard to keep up with them. So I think overall strategy for thinking through what to do when a word starts to kind of go viral in a politicized way might be higher leverage. So first thing to do is if a word your term gets politicized, is think through, is this idea helpful and productive, or is it harmful or unproductive? So if it's helpful and productive, for instance, equity, if you can, continue to use the term. And those of us who are sometimes we're in a position where we really can't, right? It's been there's been social determinants of health is another one, right? There are state health departments where it's there's a that word has been banned for lack of a better term. So if you genuinely can't use the term, find a close synonym. Find in either way, the labels are less important than the explanation that attaches to them. So always explain what they mean in nonpartisan language and make those decisions in conversation with your allies. If the idea is harmful, think fake news or groomer or radical gender ideology. First of all, don't repeat those terms. Instead, it doesn't mean go quiet or say nothing about it, but talk instead about the intent and the impact of that harmful idea. So with fake news, right, I worry about eroding our trust in journalism. Or groomer, I worry about fear mongering, right, about our LGBTQ plus neighbors and loved ones. And again, organize and strategize with allies. Concerted, coordinated efforts are essential here. Overall, I can offer you three principles for addressing, framing principles at least, for addressing these manufactured controversies. An explanation is always going to beat an assertion. Talking about the real world effects is going to beat a plain fact check. And you coming across as trustworthy is as equal or as important as communicating being credentialed. All right. Next type is of deceptive discourse and dangerous discourse is a moral panic. And this is an idea going, it's been around in sociology for longer than I've been alive, and I just had my 50th birthday. So I'm leaning here heavily on the classic work in this field, Folk Devils and Moral Panics by Stanley Cohen. And this describes an exaggerated social reaction to the perception that an event, a person, a group, or a condition is dangerously deviant and poses a threat to society's values and interests. Moral panics involve hostility toward what Stanley Cohen called a folk devil. And I use that term because it involves demonizing, right? It's not just that people are a little weird or I don't know them or they're just far away. It's that they're being described as out to get us, right? And these are typically a marginalized scapegoat with coming with a social position with little or less power. Moral panics, by definition, involve disproportion, exaggeration, and alarm. And they go through predictable stages. So it begins when somebody, a stuff starter, a moral entrepreneur, perceives and defines an event, a condition, or a person, or a group as a threat to societal values or safety. Right now, I think the groups that are being treated, painted as folk devils include immigrants, people who are transgender, people who work for the federal government, the deep state or the administrative state. I don't know that we're to in a full-blown moral panic around government workers yet, but I can certainly see people trying to start one. The second thing that happens then is that the mass media present that supposed threat using simplistic and exaggerated rhetoric and images. If that works, think from times of old, right? War on Christianity, obscenity, Sharia law. Uh, right now, we're getting radical gender ideology or woke, right? Yeah, woke ideology as some of those amplifications and simplifications. If that works, right, we get to a level of social anxiety where people are afraid of becoming a victim. And if that reaches kind of a certain point, gatekeepers such as legislators, other politicians, editors, faith leaders, or other moral thinkers speak out. And I mean moral meaning they are appealing to this in moral terms, not necessarily that they're coming from a place of deep or deeply held morality. They speak out with, we should do this. And then looking back at the history of moral panics from the Salem witch trials to Islamophobia and terrorist anxiety following 9/11, we see that one of two things happens. Either the threat is made permanent or the threat disappears, the public calms and moves on. Understanding these stages is really important to how you can respond. And I'm winding down here. Your response should meet the moment. So at the moment you see people starting to define an event or condition or person or group as a threat, what we can do is, first of all, pause. Make sure we are distilling our message, what is true, what does need to be in the public discourse at this moment, what is not playing in their frame, but thinking about ideas that we want to be out there all the time anyway, regardless of what people are starting. It's important to humanize and ally with, and talk with, and power build with those being scapegoated, but our messaging should be very humanizing. And I've got a great example of a campaign that I think Stacy will pop into the chat. And we should study those moral entrepreneurs and their business partners, again, because it will give us insight into their tactics and strategies. At the point where the words are being thrown around and picked up by media, that's a point to do your media advocacy. Ask the media to do something different. An example of this is when GLAAD, about 2.5 years ago now, organized an open letter to the New York Times, really challenging and critiquing their coverage of young people who had received gender affirming care and regretted their decision. There was a lot of behind the scenes attempts at persuasion happening first. That out front media advocacy came after and was quite effective in that particular press venue, changing their coverage. And don't repeat those oversimplifications. Instead, warn against their impact. If we're at the point of social anxiety, it's important that we actively support those who are being scapegoated and to communicate to the people who are having social anxiety in ways that calm their fears. And I want to be clear that by calming, I don't mean appeasing or placating. I mean, we want to communicate in ways that promote understanding and reduce fear of becoming a victim. The fear of becoming a victim is the fuel for a moral panic. And then if we're at the point where the gatekeepers are putting in the laws, right, or the policies that are responding to this perceived threat, it's important that we are out there with clear and concrete proposals as appropriate to our role about what we could be doing instead. And we're continuing to use calming strategies, again, not placating or going, playing dead, but positioning ourselves as a reasonable party in an important conversation, showing care and concern for the actual threats, right, that may be out there. So here's an example of this happening. So on the left, we have here an example that I saw lots of folks working to build understanding of what gender affirming care really means. But the fear, right, in this moral panic is that children are being abused or harmed or mutilated in some cases, right? That was the false moral panic narrative being advanced. And so what this response, right, from well-meaning people saying is, yes, that treatment's out there and we should have more of it, right? Not less. If people are scared of that idea of treatment, this is not our most effective frame forward. But we can humanize and normalize what gender affirming care is differently. Every young person going through puberty needs adult support as their bodies change and they discover who they are. And this principle holds for all adolescents, transgender or not. And we should be supporting families and making sure, right, that kids get what they need to develop and affirming them. And that's part of supporting kids' well-being. So that's different. Um, uh, I think for my concluding thoughts here, remembering that in a noisy, chaotic time with a lot of mistruth, our best prevention is clear communication. If they hear us and believe us first, then that is helpful. And so, your principles of plain language, your principles of staying in constant conversation, are needed now more than ever. And also, can you think about audiences more strategically? There are voices out there that are actively purveying untrue and unsound ideas for unscrupulous reasons. They are likely your immovable opponents. By definition, they are immovable. They are not your audience. Your audience is their audience. Who are they trying to persuade, right? Not again, not the people that are with them and are immovable, but who do they hope, right, to bring to that side? Think about the persuadable middle of your immovable opponent. That's your audience. For those folks who are open to conversation, taking an explanatory approach, not highly rhetorical, polemical approaches are vital in these times because of the fear factor, right? We want to be coming from a place of calm and invitational rhetoric, not argumentative rhetoric. And you want to activate those audiences, right, into to helping you defeat the deceptive discourse. And finally, if you've got allies, yay, you do have allies, yay. Folks who are support your view, of course, you want to reinforce and amplify them. But if you've got some friends who are doing the don'ts when it comes to communication, you want to equip them as fellow framers. And finally, all of us should be bringing as much evidence as possible into our communications. Here are some ways that you can access our research at Frameworks Institute. We live to our nonprofit mission by making our work available, freely available to folks like you. So please explore our website or otherwise figure out how to get in touch with us. We've got lots of ways. And the final thing you can do is be in conversations like this one. One of the strongest predictors of what people will believe is the number of times they have heard it. And so, if we are not coordinating our communications, we are diluting our power. We're contradicting each other, maybe undermining each other, or we're just being fragmented and not taking advantage of the power of repetition and coordinated strategy. So we can't all say exactly the same things. Some of us can be the tip of the spear. Some of us will need to be working behind the scenes, like in those arrows on the right, but we can certainly be moving, right, public discourse in a coordinated direction. That's all I've got to say for now. I want to hear what you want to talk about. Stacy, you want to open the chat line?
Yes. Thank you so much. First of all, Dr. Sweetland, that was incredibly informative and timely. The chat has been blown up. So people are definitely interested and engaged. As a reminder to folks, we're using the Q&A function in Zoom for questions. So drop them in there. I will say we have a lot. So we probably won't have time to get to all of them today, but I'm going to do my best. So first up, there's a couple questions around kind of how do we do this in real time. So one question is, how do you address misinformation with individuals when the topic is not your area of expertise? So this person is writing, I feel like suddenly I have to understand immunology, nutrition, microbiology, or else I'm not credible. So how do you handle situations like that?
Yeah, that's such a good question, and one that is increasingly, right, we're all going to be called on to this. So if you are in interpersonal communication, I would first be asking some questions, right? And trying to pull out what people believe, and thinking about what's the mindset underlying that I do know something about, and is there a way you can kind of diagnose their thinking at a deeper or more fundamental level? And then I would advise the classic PR technique, bridge and pivot, right? So you analyze, okay, if they're coming at this from a point of the threat of modernity, right? Oh my God, there's so much stuff out there. This new stuff is scary. The food dyes, the fluoride, the everything, right? You can then really talk about how you can address it at a more fundamental level. It's like I understand, right? There's so much science to keep up with, so much news to keep up with. I think pivoting to, right, really looking to trusted sources of information. Um, we've got as many, science can often be unlock new possibilities and solve problems, right? But pivoting to a much bigger idea that can be helpful in that moment. If you're doing this in text or print, phone a friend, right? Right, who is the group, the organized, credible group on this that is here and really, really looking for advice there. Because we cannot all be trying to solve all these problems individually. It's a waste of resources. We don't have the time, and the fragmented response is the least powerful one.
That's great. Thank you for that. Um, a straightforward question here. Some folks want to know, does this only apply to health communications or to all science communications more broadly?
Um, Good question. Um, I don't think I've said anything today that is not generally good advice on deceptive discourse. And in fact, the moral panic work, I went and kind of when people started mischaracterizing what they were calling critical race theory, which was not what critical race theory was, and calling it a moral panic over CRT, I was seeing that phrase thrown around as like almost like an insult, right? Or hyperbole in progressive critiques. And I was like, well, they're not wrong, but they're not like there's more to this theory that we can take from, right? And so I was like, I'm gonna go back and read that book I read in grad school and help think through like what does it mean for communication strategy today? So, this is thinking that we've developed, frameworks in the context of education issues. But yeah, so I don't think I've said anything today that isn't more broadly applicable.
Great. Um, a couple interesting questions around fear and how fear is being leveraged. And so this question is, why does fear seem to work one way? So disseminating misinformation or falsehoods. But this person's saying, I seem to understand we shouldn't be using it to counter misinformation. And so can fear play a role in trustworthy communication? And how do you frame that up for
Yeah.
folks?
I've gotten that question before in a version of like, how do we start our own moral panic, right? And my answer to that is, right, the like that sense of escalation, right? People getting worried about it and doing something. That in that particular, what makes a moral panic its particular thing is that it involves scapegoating an other, right? It only works, right, by making a person, a group, or a condition a threat that isn't that isn't true, right? Or certainly wildly exaggerated. So I don't think any of us on the side of public health are on the side of scapegoating, right? So that's one reason. And that wasn't the exact question here. Does elevating people's sense of concern, can that be a form of motivation for change? Absolutely. Concern and a sense of urgency is not the same as fear. So, can we elevate the sense of concern and urgency while also elevating a sense of efficacy? So, you want people to know there's a problem and that it's a serious problem so that they will engage and take action. But if that's all you do, you're more likely to be sparking overwhelm or apathy, or let's look to somebody else to solve this problem for me. Let me find my local strongman to come in and save the day. So that fear, right, that fear response is not working for us. A concern, urgency, and a sense of collective power. There's solutions beyond this. Join us, right? Those two together, I think is where we want to head.
Great. Thank you. One question, how do we help the threat disappear rather than being made permanent? And I know you touched on this, but maybe you
Yeah.
can.
I mean, that is the question, right? And that's what everyone wants to know. I hope that the slide that I had that had the tactics at different points, right, are part of that. Are that is right. That is my answer to that question, is thinking about what stage you're in and what you do. And so I can throw that slide up again so people can stare at it a bit more. But I won't repeat it for so that we've got time to get to other questions.
Yeah, that'd be
But
great.
they do disappear, right? They do disappear sometimes. Um, for instance, if you're old enough to remember the 1980s panic over punk rockers and the kids who were putting, safety pins through their lips, right? Nobody's worried about that anymore, and piercings have become widely normalized, right? That one disappeared. That humanizing and normalizing, that lifting up general small L liberal values, right? Live and let live, room for all of us, abundance, what used to be called tolerance, which we prefer to talk more now about as affirming, welcoming, belonging, right? Those sorts of things are key to continue to advance.
That's really helpful. I think along a similar line of questioning, there are a couple questions from folks here along the lines of, won't there be just some people who you're never going to convince? So when do you know it's time to just throw in the towel or protect your own mental health, or kind of peace out from the conversation versus engaging?
Yeah, so there's a lot in there. I would say that, I started with the big piece of advice for this whole moment, whether you're up against deceptive discourse or funding being cut or whatever, right? Whatever the chaotic, whatever form of chaos is around you, we have to prepare ourselves to respond, not just react. And at times, that preparation is self-care. So that you can re-engage at a point when you're your best, wisest, smartest, strategic self. Um, so yes, affirming and encouraging that. Um, how do you know the audience is immovable? That is often an empirical question that we can figure out through good research. I will say that what we have found at Frameworks consistently on research on many divisive topics, 50 different social issues across 25 years, a database of many hundreds of thousands of Americans, is that the persuadable middle is bigger than we're taught to believe, than we would believe based on elite rhetoric, elite political rhetoric, at least. Um, and understanding is largely frame dependent. Right, the way we engage issues, right, has a lot to do with whether they are immovable. So without knowing more about the context, where are you? What's the issue? What are you trying to move folks to? I can't answer that question. But I can say there's probably more room to do good than you think. And then I'll also say that peace out on the whole conversation, whether you as an individual have the fortitude right now to be engaged is a you question. An us question, a sector-wide question, is if we are not staying engaged in some of these issues, right? One of the strongest predictors of what people will believe is the number of times they have heard it. If we are not keeping the humanizing, science-based, institutional accountability and presence kind of ideas out there, people will be that much more susceptible to the misinformation and spin that we're seeing. So that doesn't mean we have to chase down and play whack-a-mole with every single piece of misinformation. There are pieces out there, and I'll look these up and we can distribute them on how to kind of decide, has it risen to a level of threat that it's worth addressing? But when it's clear that this is a thing, staying out of it is usually going to make it worse as a sector.
That's really helpful. That's a nice positive message to wrap us up. But I'm going to ask one more question because we have so many here, but this is also a nice one. Some folks are wondering if there are, I know we've shared some links to your website to different studies, but people are also interested. Are there specific books or articles or other websites that folks can read and maybe share with their colleagues? So I thought that would be a nice way
Oh,
to wrap us
yeah,
up.
that's a good one. This is a super nerdy reference, and it is, I hope nobody from WHO is on, but it's not the most beautifully graphically designed thing in the world, but it's so good. It is responding to vocal vaccine deniers in public. And so we'll find the link for that. But what I like about it is it has a heuristic, a strategy. How do you think through how to respond? And they've done a lot of topic specific research on vaccination in particular, but the thought process I think applies to a lot of things, and it's really informed my own thinking. Um, and I am totally blanking. Um, but I would Marian McMullen's new book, which is called something like Persuasive, I think, is I think it's my latest favorite in a long list of things that I think are helpful.
On your bedside table. Perfect. Well, we are close to time here, so I'm going to wrap us up. I want to just thank you again, Dr. Sweetland and Frameworks Institute, for today's webinar. That was fantastic. I'm going to put up my closing slides here and wrap us up. So thanks again, folks. Thanks to Julie and thanks to everybody for all of your great questions today. I'll do my little Society for Health Communication pitch, which is that we will be holding our 9th annual summit this year on Tuesday, June 24th. We are doing it. It is confirmed. It's a go. It will be a hybrid event, so both in person and virtual. And I know travel budgets are tight. And I also hope you all will consider joining us in person. Registration will be opening very soon. We have a special issue of the Journal of Health Communication coming out, sponsored by the Society, so we're very excited about this. It's coming out later this month, so please be on the lookout for that. And finally, if you are not already a Society member, I hope you will join us. You can engage with us on LinkedIn, send us suggestions for future webinar topics and speakers like the one today. And we're also asking members to share their experience and suggestions with us about how we can support you all during these challenging times. So we'll drop a link in the chat, but we have a form where you can share some anonymous feedback and suggestions for us, and we are taking that to heart. And then lastly, I hope you'll take a moment to tell us what you thought of the webinar today. So we'll sharing also a link to a quick survey in the chat. You'll also get that in your inbox following today's event. And as we noted, we will be making the recording of the webinar available on the Society's website in the coming weeks, so stay tuned for that. I don't know about you all, but I am looking forward to rewatching it and getting all those insights from Julie. So thank you all for joining us today. I hope you have a great rest of your Thursday, and we will see you all soon.